Welcome to Medicare Madness, the basics of Medicare explained. Medicare is federal health insurance for people age 65 or older, but you can also qualify under age 65 with certain circumstances such as having end-stage renal disease or kidney failure, or being on Social Security disability benefits for 24 months. There are other ways to qualify for Medicare, so please contact Social Security for additional information. Now we'll go through some important definitions that you need to understand when you are looking at different health plan options so you understand what your out-of-pocket liability could be. A copayment or a copay is a set amount that you are required to pay for a service. For example, a $20 copay when you go for a doctor visit. Coinsurance is different from a copay in that it is a percentage of the allowable cost. So your out-of-pocket can really fluctuate with coinsurance. Deductible is the amount that you have to pay before the health plan or the drug plan begins to pay anything for the year. And the premium is the amount that you have to pay to have the health plan whether or not you use it. Now let's go through the different parts of Medicare. Medicare Part A and Part B are what they refer to as Original Medicare or Traditional Medicare. Part C is Medicare Advantage. It's another way to get your Medicare coverage. It's through private insurance companies that contract directly with Medicare and bundle Part A, Part B, and Part D all under one plan. Medicare Part A is free for qualified individuals. They refer to Part A as your hospital insurance. This covers anything inpatient in a hospital, a skilled nursing facility. It's important to understand that you need a 3-day inpatient stay in a hospital to qualify for skilled nursing care. This is not custodial or long-term care that people associate with being in a nursing home where you cannot perform your activities of daily living. Medicare does not pay anything for stay in a nursing home. Part A also covers hospice care services when you're deemed to be terminally ill and home health care services in your home. Medicare Part B is referred to as doctor's insurance. This covers primary care, specialist, outpatient services such as lab work, diagnostic tests, and all of your preventive services are covered at 100%. The premium for Part B is $144.60. Now this may be higher based on your income. There's income-related adjustments that can be added to your Part B premium as well as your Part D premium. Please contact Social Security for additional information on income-related adjustments. Medicare Part D is prescription drug coverage, and there are two ways to get your drug coverage through Medicare. One is to go through a Medicare prescription drug plan, and these are added when you stay with Original Medicare Part A and B and buy a Medicare supplement to cover your medical. There are 31 different prescription drug plans available in each area. The other way to get your prescription drug coverage is through a Medicare Advantage plan which bundles Part A, Part B, and Part D all under one package. Costs for Part D plans range from $13.20 to over $100. The deductibles vary by plan. The standard deductible is $435, but can go down as low as $0. Each plan has different co-payments and co-insurances based on the tier that your prescription is covered under that plan. Now, whether you do a prescription drug plan, one of those 31 standalone plans available, or a Medicare Advantage plan, all plans work the same in that they have 3 different coverage levels. You have what's called the initial coverage level, the coverage gap or the donut hole, and then catastrophic coverage. Your initial coverage level is where the drug plan keeps a running tally of the retail cost for all your prescriptions filled through that drug plan. During this time, you pay your annual deductible and then whatever the regular copay or coinsurance is based on where your drug falls on the formulary tiers for that plan. The initial coverage level ends once your total retail costs have reached $4,020. The Medicare Part D coverage gap or donut hole begins when your total drug retail costs reach $4,020. From that point on, you pay 25% of a covered brand or a covered generic. This continues until your true out-of-pocket annual drug cost reaches $6,350. The third level of coverage is catastrophic coverage. This begins when your true out-of-pocket annual drug cost reaches $6,350. At this point going forward, you pay either a set copay of $3.60 for generic or $8.95 for brand drugs. Or you pay 5% coinsurance of the retail cost, whichever is the greater amount. The items that count toward your true out-of-pocket annual cost are your annual deductible and any copays or coinsurance you pay during the initial coverage level. Additionally, the 25% coinsurance that you pay on a brand or a generic drug when you're in the coverage gap. There is also another mechanism built in to help people that have high-cost prescriptions. And what this is, it's where you receive the discount you receive on the brand name drug when you're in the donut hole. There's a 70% discount applied to the 25% coinsurance that you pay. So essentially you are being credited with 95% of the retail cost of the brand. An example of this is if you are on a prescription that costs $1,000 a month, you are paying 25% of that during the donut hole. So you are paying $250 out of pocket. However, you are credited with 95% of the total cost, and that is added toward that $6,350. So it's a way for people that are on high-cost retail brand name drugs to get through the donut hole and into catastrophic coverage, where then they would be paying 5% instead of 25%. Items that don't count toward the coverage gap are the drug plan premium that you pay, and then if you buy any drugs that are not covered by the plan, for example, something that you would buy over the counter. Also, if you have any vitamins or supplements prescribed by your physician, those are not covered by Medicare Part D plans, so those costs would be all out of pocket to you. I hope this information was very helpful. Again, I'm Independent Medicare Advisor. My website is www.medicaremadness.com. You can email me at john@medicaremadness.com, or feel free to call or text me at 717-798-1603. And again, there is no charge for my valuable service. Thank you and have a wonderful day.